Question here, due to a high census, it has been necessary for number of clients to be transferred to the other unit within the hospital. Which client should transfer to the postpartum unit? Means who is most stable? A 66 years old female with a gastritis, means inflammation of the stomach. Number B, a 40 years old female with a hysterectomy, means remove the uterus. Number C, 27 years old man with a severe depression. It is the mental disorder. And number D, a 20 years old man or male with a ulcerative colitis. So out of all, who should transfer to the postpartum unit? Right, my friend? There are two ways we can answer. Postpartum. So gastroenteritis, who has a problem in the stomach, nothing related to the female organ. Postpartum means antepartum, peripartum, and postpartum. Gastritis not related to the postpartum. Severe depression not related to postpartum. Ulcerative colitis is a disease of the colon, nothing related to postpartum. But here, hysterectomy is the most common, which is related to the postpartum, right? So the answer B is correct. The best client to transport to the postpartum unit is a 40 years old female with a hysterectomy. The nurse on postpartum unit will be aware of normal amount of bleeding and will be equipped to the care of this client. Postpartum, they used to with the case who have hysterectomy. So the client with gastritis or the client with a severe depression will be the best care for an medical surgical unit, not a postpartum. The client with a depression means answer C should be transported psychiatric or mental health unit, not a postpartum unit. What else? What next? Next question goes to a client with a glomerulonephritis, means the disease of glomerulus, right? Glomerulus is a structure inside the nephron. Nephron is a unit of the kidney. When the inflammation occurs, antigen antibody and reaction occur in glomeruli, kidney make non-functioning. We call glomerulonephritis. It's placed on a low sodium diet. Who have a kidney problem, we always advise them intake low sodium. Which of the following snacks is suitable for the client with glomerulonephritis or kidney problem with a sodium restriction, right? There are 4 kinds of food. Which one contain less sodium? So you give the patient who have a kidney problem. Number A, peanut butter cookies. Is it low sodium? I do not know. Number B, grilled cheese sandwich. Maybe it is full of sodium, or I do not know. Number C, cottage cheese and fruits. I like fruits, but cottage cheese is there, sodium is there, or I do not know. Number D, fresh fruits or peach. This is a complete fruits or vegetables, no question come. Sodium more or less, absolutely. We choose number D. Fruits there, but also cheese there. I do not like it. Cheese sandwich, I do not like it because it contains sodium, contains preservatives. So answer D is correct. So the fresh speech is the lowest in sodium of this list or choice. Answer A, peanut butter. Answer B, cheese sandwich. And answer C, cheese and fruits have much higher amount of sodium is there. We do not like it because my patient has a kidney problem. What you said? So next question goes, a home health nurse is making preparations for morning visit. Which one of the following client should the nurse visit first? Prioritization question. For patient who is emergency, you need to see first. Number A, the client with a stroke and with a tube feeding. Number B, the client with a congestive heart failure complain of nighttime dyspnea, shortness of breath, we call dyspnea. Number C, the client with a thoracotomy 6 months ago. So part of the thorax cut and remove, maybe underlying cause carcinoma, lungs. But it is 6 months ago, nothing bad. Tell them to wait. Maybe you have a more serious patient waiting for you. Number D, a client with a Parkinson disease. Parkinson disease, it is the degenerative brain disorder. Patient will not die because of Parkinson. So number D is not an answer. Number C is not an answer. Number A, client with a stroke with tube feeding. This patient is stable, right? But number D, B, has a problem. What is the problem? Shortness of breath, right? A, B, C, D. A for airway. When I choose my answer, I always check. A means airway, right? Airway, check first. Then B for we can check breathing. Breathing is okay or not. Then C, we check the circulation. We check the blood pressure. If blood pressure is too low, patient chance to develop shock. It is called cardiogenic shock. If you do not take care, patient will die. And D for any other disabilities. And you have to remove your patient from the source of danger. Right? So my patient client, congestive heart failure, complaining nighttime sweat, dyspnea. It is airway problem, breathing problem. This is the first priority. So the client with congestive heart failure who is complaining of nighttime dyspnea should be seen because airway is #1 in nursing care. In answer number A or answer number C, thoracotomy, answer number D, Parkinson, the clients are more stable. They will not die if you be late. The brain attack means answer A is the new terminology for the stroke, right? So what next? Next is here. So a client with a cancer developed the xerostomia. And patient has a cancer as well. The client, the nurse can so I said the nurse can help alleviate the discomfort for the client is experiencing associated with xerostomia. By how? So xerostomia means dry mouth, right? So salivary gland in the mouth do not make enough saliva and keep the mouth wet. But when my salivary gland does not work, no saliva, no wet, mouth should be dry, and this is called xerostomia, right? So dry mouth is not always related to the underlying condition, but it may be caused by some disease like nervousness, stress, certain medication, aging, cancer therapy, smoking, injury, or surgical cause. Even the person who is smoker, tobacco smoker, they have a chance of dry mouth. So now question, what we offer? Offering hard candy, administering analgesic medication, splinting swollen joint, and providing saliva substitute. So the correct answer is number D, provide saliva substitute, because xerostomia is a dry mouth and offering the client a saliva substitute will help the mouth. Eating hard candy in answer A can further irritate the mucosa and cut the tongue and lips. Administering an analgesic might not be necessary. Thus, answer B is incorrect. Also, swollen joints, and answer C is not associated with xerostomia, right? So if you ask me, what are the other treatment, right? So we always educate patients self-care steps that may be helpful in some less serious cases. Also, sometimes we advise patients for chewing gum or chewing sugar, right, which is sugar-free gum, right, or free hard candy, or sometimes it stimulates the flow of saliva. Also limit your caffeine intake, coffee intake. Do not use the mouthwash that contain alcohol, or we educate them stop smoking or sip of water. Try a mouthwash designed for dry mouth. Also educate your patient to avoid using over-the-counter antihistamine or decongestant. Also, it is important to educate them breathing through the nose and add some moisture to the air at night, right? So what next? The nurse is making assistant for the day. The staff consists of a RN, LPN, and nursing assistant. Which client could the nurse assist care for? Which client nurse assistant CNA supposed to care? Who is the most stable patient? Number A, client with the Alzheimer's disease, right? Number B, client with pneumonia. No, pneumonia is the infection. Anytime can cause serious condition, less oxygen. You need critical thinking. CNA is not a good for number B. The client with the appendicitis, so dangerous, pain. You need assessment. You need organ or arrange for surgical operation, pain management. Definitely CNA is not good for him. Number D, the client with the thrombophlebitis. Oh my God. Thrombophlebitis can cause any other complication like DVT, right? Out of all, we can see Alzheimer's patient is most stable. So the answer A is correct, right? Answer A is correct. So the client with the Alzheimer's disease is the most stable of this client and can be assigned to the nursing assistant who can perform the duties such as feeding and assisting the client with the activities of daily living. The client in answer B, the client with answer C, appendicitis, or answer D, thrombophlebitis, should be attended by a registered nurse or RN. What next? The nurse is caring for a client with a cerebral palsy. The nurse should provide frequent rest period because, right? What are the result? So number A, grimacing and withering the movement decrease the relaxation and rest. Number B, hypoactive, deep tendon reflex become more active with rest. Number C, stress, the reflexes are increased with rest. And number D, fine motor movement are improved by rest. So my friend, this client have a cerebral palsy. What is cerebral palsy? So cerebral palsy, a group of disorder that affect the movement, that affect the muscle tone, that affect the balance and posture. So urgent medical attention usually recommended in severe cases by healthcare provider, right? The patient who have cerebral palsy, the sign and symptom generally appears during infancy or preschool year or even directly between individual. Disability can be on one side of the body or affect the whole body. Let me tell you something more. The movement and coordination problem sometimes impaired the muscle coordination, involuntary movement problem, abnormal or exaggerated reflexes problem, slow and withdrawing movement problem, or septic paralysis, abnormal posture, excessive drooling, difficulty of speaking, ear muscle imbalance, and also neurological disorder. What else? What are the answer from here? The nurse should provide frequent rest period. Why? Why my patient need this? The answer should be the grimace or movement decrease the relax and rest. So this is the answer, right? Movement decrease the relaxation and patient can rest. So the frequent rest period help to relax the tense muscle and prevent and provide the energy. So B, hypoactive deep tendon reflex. C, the stress the reflexes or fine motor movement incorrect because they are stimulus about the patient who have cerebral palsy. So before to go next question, I want to share something with you. We are nurses. So nursing goals for a client with a cerebral palsy include optimized mobility and prevent the deformity, improve their daily lifestyle, and also important to prevent the fall. It is the nursing goal. So what next? Here. So the physician has ordered a culture for the client with suspected gonorrhea. The nurse should obtain the culture of blood, then nasopharyngeal secretion, right? And also stool or genital secretion. So first of all, my client has a gonorrhea, not syphilis. So like here, suspected gonorrhea, I said. So first of all, I want to tell you the gonorrhea is a sexual transmitted bacterial infection caused by bacteria Neisseria gonorrhoeae, and it often affected urethra or rectum or throat. The person who have gonorrhea, the symptoms start to slow up after a week of infection. It can be vary from person to person. Some people may not show any symptom. But the most common symptom may include frequent urination, a pus-like discharge from penis, swelling or redness at the opening of penis, swelling and pain in the testicles, or persistent sore throat. Symptom in case of women, usually most common, discharge from vagina, pain or burning sensation while urination, tendency of urine frequently, or feeling heavy period of spotting, pain during the sexual intercourse, and also sore throat and fever. So how we diagnose it, right? So healthcare provider may recommend one or more of these diagnostic tests or procedure as part of an evaluation of the disease. And diagnosis involve laboratory tests to confirm the infection, right? So common test and procedure, basically a swab test we do. A swab test means a sample of collection either from genital or mouth and tested for presence of bacteria. So the answer is supposed to D, genital secretion we have to collect. So the culture of gonorrhea is taken from genital secretion. The culture is placed in a warm environment where it can grow Neisseria gonorrhoeae, which is the organism. So answer A means blood, answer B, nasopharyngeal secretion, and answer C, stool are incorrect because this culture do not test for gonorrhea. Another most common disease is called syphilis. Syphilis is highly contagious sexual transmitted bacterial infection characterized by painless sore or on the genitalia and rectum and mouth. So the difference between gonorrhea, pus-like discharge occur, but in syphilis enlarge the lymph node, small painless sore, small or reddish brown sore on the skin, sore in the mouth, vagina or anus. Sometimes patients have a fever, swollen the lymph gland, weight loss, even extremely feeling tired. What next? Next, which of the following post-operative diet is the most appropriate for the client who had hemorrhoidectomy, right? So the person who has hemorrhoid, so what kind of food you prefer, right? So hemorrhoid basically also known as piles. Sometimes swollen vein in the lower part of rectum and anus that causes the bleeding and discomfort, causes due to the straining during the bowel movement or obesity or during the pregnancy. It is most common. What else? So question here, what kind of food do we prefer? Number A, high fiber. B, lactose free. Number C, blend. And number D, clear liquid. I know you have a two confusion, number D or number A. So the correct answer is, so they said postoperative diet, postoperative. Keep in mind, this is the important keyword, help to find out which one is answer, A or D. My patient, the post-operative, definitely clear liquid is the choice out of all. So after the surgical operation, the client will be placed on a clear liquid diet and progress to a regular diet, right? So high fiber is not a choice at this time. So stool softener will be included in the plan of care to avoid the constipation. Later, the high fiber diet is a choice, answer A, but not now. We encourage my patient for the future. But this is not the first diet after the post-operative or surgical operation. Answer B, lactose-free. Answer C, blend are not diet for this type of surgery, right? So if you ask me, what are the other treatment options for person who have hemorrhoid? So our provider will work with you to deep a care of plan that may include one or more of this treatment option. What it is, we give them medication we call conservative medication like analgesics or fiber supplement can work. If medication does not work, we go for some procedure. It is called rubber band ligature or sclerotherapy, hemorrhoid stapling, or hemorrhoidectomy, right? In the same time, we educate patient about the self-care. What is self-care? So always talk to your provider before starting anything. So the example, the topical treatment and warm water reduce the discomfort. Avoid using soap or rough toilet paper. Very important because we are nurses. And finally, before to go next question, I want to tell the person who have hemorrhoid, the nutrition is important. So food, what kind of food they should eat, right? It is good to eat legumes such as some kind of peas, lentils, black beans, also some whole grain such as barley, right? Oatmeal, brown rice is good. Vegetables such as green peas, broccoli, Brussels, fruits is good. Or what kind of food they should avoid, like white bread, milk, cheese, meat, alcohol, caffeine, spicy food, right? They should avoid. So what else? The next questions. The client delivered a 9-pound infant 2 days ago. An effective means of managing discomfort from an episiotomy is, right? So medicated suppositories, right? Taking shower, seed bath, and ice pack. Effective meaning discomfort from episiotomy. What is episiotomy? It is a surgical procedure, surgical cut made at the opening of vagina during the child delivery or childbirth to aid a difficulty delivery or prevent the rupture of the tissue. But when episiotomy done, it is important to take care of it. How we take care of episiotomy, right? So they said Medicaid suppositories or taking shower, seed bath or ice pack. The correct answer is number C, seed bath. A seed bath will help with swelling and improve the healing. Ice pack, answer number D, can be used immediately after delivery. But answer A, like medicated suppository, answer B, taking shower, are not used at this instant. What else? What next? Next here, the nurse is assisting the client recently returned from surgery. The nurse is aware that the best way to assess the pain is number A, take the blood pressure, pulse, and temperature. Number B said, ask the client to rate his pain on the pain scale 0 to 5 or 0 to 10. Number C, watch the client facial expression. It is one way, but not answer. Ask D, ask the client if he is in pain. So number D, you can ask, but you do not grading the pain. So the nurse is aware that the best way to assessment the pain is, answer is number B, ask the client to rate his pain on the scale 0 to 5 or 0 to 10. So the best way to evaluate the pain level is to ask the client to rate his pain on a scale. The answer A means take blood pressure, pulse, or temperature can alter for other reason than the pain. Answer C, watching the client facial expression. Answer D, the client asks the question, are not an effective in determining the pain levels.